Welcome to the Medical Dialogues. I'm Dr. BP Rahul, Senior Medical Correspondent at Medical Dialogues, and today I will be discussing about a very interesting topic. Minimally displaced Jones fracture can be managed with immediate weight bearing in walking boot. A Jones fracture refers to a break between the base and shaft of fifth metatarsal bone of the foot. The fifth metatarsal is the long bone on the outside of the foot that connects to the smallest toe. A Jones fracture is a common type of metatarsal fracture and is the most severe type of fracture that can occur in this bone. This fracture takes its name from orthopedic surgeon Sir Robert Jones, who first reported and treated the injury in 1902. Jones fracture have a high risk for non-union due to vascular watershed region. Classically, treatment consists of weight-bearing restrictions in a cast or surgical fixation. Some studies have assessed immediate weight-bearing following a Jones fracture. Anluk and others conducted a study to analyze outcomes after treating adults with acute Jones fractures non-operatively without weight-bearing restrictions in a walking boot. This study hypothesized that patients will not require future operative intervention following functional treatment. A retrospective review of 55 adult patients who sustained acute closed Jones fracture was conducted. 47 were treated weight-bearing as tolerated in a walking boot and 8 were treated non-weight-bearing in a cast. They were followed radiographically by an orthopedic surgeon for an average of 6.4 and 15.5 months respectively. 3 patients in each group developed painful non-union leading to surgical fixation. 30 patients in weight-bearing as tolerated group demonstrated radiographic union on final radiographs. Only 2 of the 15 patients with partial union were seen at least 6 months from time of injury, one of whom had ongoing pain but declined surgery. The remaining 13 patients were asymptomatic at their final clinic appointment. The authors concluded that multiple medical specialties are involved in the evaluation and treatment of Jones fractures, but controversy still exists regarding the best treatment methodology for acute Jones fractures. This study result supports the treatment of acute minimally displaced Jones fractures in the low demand, adult, non-elite athlete population as weight-bearing without restriction in a walking boot. This treatment method was the potential to decrease the need for casting, prolonged follow-up, and the burden on the older patients to maintain weight-bearing restrictions while maintaining the satisfactory outcomes. The increased evidence of successful treatment in a walking boot may help alter how other medical specialties manage acute Jones fractures. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.